Joining us now from our Abuja studio is Johesu Chairman, National Hospital Abuja Chapter, Jane Agabi. It's nice to have you join us, Jane. The strike that is ongoing now has been described by government and even Nigerians from different perspectives, depending on how it touches them. Government says the strike is illegal, ill-timed, and is insensitive. What do you say to this?
First of all, I want to say that the strike is legal. It is legal because we followed the labor rule by giving a 15 days, ultimatum, at the expiration of which we declared a 7-day warning strike, and that is the law. And so the strike is very legal, and the government have left us with no choice than to embark on the strike.
When you say the government has left you no choice, the government says it has been making efforts to resolve all the issues with the joint health sector unions, and that according to the ILO Statutes and Trade Dispute Act of 2004, that in a pandemic, health workers are not supposed to go on strike.
The government has not made effort. There are cases, issues that have been there since 2014. There are issues of 2017. There are issues of 2018. And if the government had made efforts in all these years, these issues would have been tackled. As we speak, none of those have been done. Even in the cases where we have won in the National Industrial Courts, the government have refused to secularize or to implement these issues. And so I don't see where the government has actually made any effort.
All right. Government said they had paid about 20 billion naira for, I think, April and May, and then 8 billion naira for June as part of COVID-19 hazard allowance and some inducement. How far is that when it comes to part of the demands that you are making to government?
Have not been paid the balance of 40% for April, May, even June as we speak. So I don't know what, I don't know what the government is saying. We have not seen it physically, by our members receiving any form of alerts.
Now, what are the grievances? Because you mentioned...
I would like...
You mentioned issues of 2017, issues of 2018. How were discussions going on between you and government? What was the level of engagement before it got to this point?
Now, if you have been following the trend, you would observe that the government does not keep to its agreement with us. For instance, in 2014, our consolidated salary, CONHES, was supposed to have been upgraded as they did for other commerce salary scale. And then it was not done in 2014. In 2017 again, they upgraded that of the commerce, and CONHES was not upgraded. And those are the issues that we've been talking about. And we've been, pleading. We have been bargaining. We have been negotiating. We have used all methods available to see that the government, cease to apply, but so far no results. And it is the results that the common man would see and believe that something is going on.
All right. When it comes to the issue of agreement and government not sticking to its part of agreements with you, can you run us through, at least itemize some of these agreements that government had agreed to abide by and they did not, according to your grievance?
Okay, now, we were in court and we won cases of consultancy, won cases of our members being head of departments. We won cases of internship. As we speak, most of the hospitals have not started internship programs for some of the, the Johesu members that are supposed to have internship programs. And, the government has not kept to any of this. Retirement age had been agreed 3 years ago, and the government took us to court, and we won all of these cases. As we speak, 3 years after court judgment, none of those issues have been implemented or secularized. So the issues are like they are not existing, like they are not, we have not even gotten them. These are issues we got, even by a court judgment, which the government has not kept to.
But why wait till this time, seeing that we are in a pandemic? Aren't you concerned that the lives of Nigerians could be endangered?
Now, if you remember, we went on strike in April, May 2018, and the government said, they were going to enforce the no work, no pay rule, and our salaries were withheld since 2018. And we have been negotiating, we have been bargaining, we've been discussing with the government, and for these salaries to be paid up to, as we speak, we have been pushed to the wall. We have been left with no other choice because the government have not heard our bargains. They have not heard our plea. They have even taken our patience for granted because we've been this patient. And this strike would have come before now, and we just had to wait because of the pandemic. And as humans, I think we have done and kept our own part of the bargain, and we wait for the government to do their parts.
All right, Jane Agabi, we have to leave you here now. Thank you so much for talking to us on TVC News.
Thank you very much.
All right, let's quickly look at your demands at this time, which was narrowed down to 5 major areas: the structural and infrastructural decay, and you also talked about corrections in the areas of COVID-19 allowance. Could you help us better understand where the grievances are with regards to these demands?
Now, as we speak up till this moment, the balance of the COVID-19 allowances have not been paid to our members, and we demand that be paid by government urgently. And we will be glad if we have, our hospitals properly equipped and we have a functional equipment so that we can be able to cater for our patients effectively. And that is not too much to ask from our government.
All right, talking about equipping hospitals and infrastructure, everyone knows that it takes a long while before that can be done. But what would you like to see first as a way of a government making effort?
We would want to see, broken down equipment being fixed. We might not be able to, have them replaced within this short period of time, but we can have them fixed. Those that are bad can be fixed, and then the place can now, get working so that the patients can be attended to optimally.
All right, so what has been your level of engagement with government all the while? The minister said that there has been a lot of engagement with your union, at least the last meeting that took place sometime last week.
Yeah, our national body has been meeting with the government, but so far those meetings have not yielded any positive results.
Now, there was one of the demands made, which also has to do with the allowances, was for the government to give a 50% on the consolidated basic salary as hazard allowance, but government talked about being able to give about 10%, according to the report from that meeting. Yes. Are you also putting into consideration the economic situation across the world as we speak, seeing that not just Nigeria, but every other country have been hit by the pandemic?
Yes, the economic situation the world over is alarming, and the health workers are not the only ones to bear the brunt, because when it comes to attending to government officials, top government officials, the phone is readily provided and available to do whatever they want to do. And when it comes to paying the common man who buys from the market, you will begin to hear things like, lack of fund and all of that. And we think that is not good enough.
All right, quickly before we let you go, so what will be the grounds for which your union will be looking to shift grounds with the government?
We would like the government to pay our 2018 April-May salaries that were withheld. Many unions before that time and after that time have gone on strike in Nigeria, and nobody's salary has been withheld. Health workers have not committed any crime, and so we deserve to be paid our wages, and so we demand to be paid our wages.
All right, Jane Agabi, thank you so much for speaking with us on The Breakfast Show this morning.
Thank you very much.